America's top doctor has called for risk warnings on alcoholic beverages similar to the labels on cigarettes, following new research that links drinks to 7 types of cancer. To see the light of the day, it would require an act of Congress to change the existing warning labels, which have not been updated since 1988. Details in our next report.
According to an advisory by the US Surgeon General Vivek Murthy, alcoholic drinks should carry a label warning consumers about their cancer risks, noting that alcohol consumption increases the risk of developing breast, colon, liver, and other cancers. Vivek Murthy also called for the guidelines on alcohol consumption limits to be reassessed so that people can weigh the cancer risk when deciding whether or how much to drink. Cancer epidemiologists have welcomed the advisory.
We have control over our choice to drink alcohol or not. And that if someone wants to have a little bit of alcohol because it's just part of their lifestyle, then they just need to do the calculations for themselves. But what they need to think about is sort of long-term daily consumption and how that may influence the risk of cancer and other chronic diseases.
Some have welcomed the move, while others are skeptical of any benefits it may bring.
It's good to tell the consumer of risks. Let them make the decision.
Well, I think even though it might not help, it might make people stop and, take a second thought about it. So in that respect, it may help a little bit.
I disagree with the extra input and the expense of trying to label things like that. We're adults. You have to be 21 to drink. You should be able to know.
I think a lot of things can cause cancer, and it doesn't stop people from partaking and enjoying these things. I think that alcohol can also lead to a lot of other things other than just cancer, probably. So putting a label on every alcoholic bottle seems a little far-fetched for me.
Alcohol consumption is the third leading preventable cause of cancer in the United States. Alcoholic beverages in the United States currently carry a health warning label unchanged since 1988, advising pregnant women against consumption, as well as warning those who may be driving or operating machinery. The decision to update labels will ultimately be made by Congress. Bureau Report, DD India.